So, you have asthma. If you're watching this video, you or someone you know has been affected by asthma. In this video, I'll give you a brief description of what asthma is and how Montelukast it will affect that asthma. I know you probably have a lot of questions, and I have some answers for you. In this video, I'll give you the questions that I normally get, and I'll give you some answers to go along with them. Asthma is a respiratory condition that involves the tightening or bronchoconstriction of your airways, as well as inflammation. Typically, when you are diagnosed with asthma, you are given two medications. One medication is used in order to control inflammation, and the other medication is used in emergent situations. The one to control inflammation is typically taken once a day, and then you're done. And the other medication is used when you have asthma attacks. Montelukast is the type of drug that you use to control inflammation, so it's taken once daily. So let's start with the most common question. Why are you being put on this medication, or why should you take this medication? Montelukast is not typically the first line of defense for asthma. However, it is still used pretty frequently in the treatment of asthma. Typically, Montelukast is prescribed to go along with other asthma medications, or it's prescribed when other medications just aren't working for you. Your dosage of this medication really depends on why you're taking it. You may also be prescribed Montelukast because of the side effects of other asthma medications. For example, one of the asthma medications has been shown to slow growth in children. However, that is not a side effect of Montelukast. You will most likely be prescribed Montelukast if you don't have serious asthma attacks or you don't use your rescue inhaler frequently. The next question that you may have is, what does this medication do? How does it work? Well, Montelukast is what is described as a leukotriene receptor antagonist. All these types of drugs do is block receptors that cause asthma. Think of this as a key and lock system. All the tiny particles of your medication are the keys, and the receptors are the locks. Typically, when these locks are open, there are tiny particles and chemicals flowing in and out of them freely. Without your medication, these locks are open, and you may be experiencing things like tight chest, or you may just be having difficulty breathing in general. When the locks are open, certain chemicals are released into your airway, causing your lungs and the blood vessels in them to constrict. In order to keep you from experiencing these symptoms, it is important to take a medication that helps you control your asthma at all times. Like I said previously, the medication you take is your key to the lock. The key closes the lock, keeping it from letting things like other chemicals flow in and out of it. This helps to control the constant inflammation you may experience when you have asthma. You may be wondering, where are all these fancy locking keys located? The locking keys are located throughout the respiratory tract, meaning they're located in your lungs and in your airway. Montelukast acts locally, meaning it doesn't have to work all over the body. It kind of just stays in the lungs and does its job right there and then. A cool thing about this medication is that you only have to take it once a day. So you don't have to worry about timetables and things like that when taking this medication. Normally it's prescribed to be taken at night, and it's also a single dose medication, meaning you only take one single puff and then you're done. How much medication you take is normally dependent on age. So adults take the biggest amount, which is about 10 milligrams. And the reason that amount is used is simply because after increasing 10, 11 milligrams, there has been no effects after that. So they just kind of stuck with 10 milligrams as the gold standard for treatment. As with any medication you take, you should monitor yourself for side effects or anything out of the normal. If you start to experience skin rashes or flu-like symptoms, nausea, headache, runny or stuffy nose, fever, loss of appetite, be sure to inform your athletic trainer or your doctor. Although rare, some people on Montelukast start to have increased agitation, anxiety, or insomnia. These are things that you definitely should inform your athletic trainer about, as well as your doctor, so that we can find a best way and a best care plan for you. Alright, that's all I have for you. If you have any more questions, feel free to contact me. I'll be in the clinic at 2 today.